Sarah, can you hear me?
Yes, I can hear you.
Okay, so in case my name, just put Victor in Zenwa. Remove the OG. Let me put the OG.
Okay.
Just NZENWA. Or just Victor is fine. Anyone.
Oh God. Spell the NZ1 again. NZE.
NZENWA.
Yeah.
Hopefully this should not be more than an hour, give or take.
Yeah, hopefully. I hope so too.
Dr. Michael's slide is long. It's like 33 slides.
Yeah, he's basically going through it, so you're not supposed.
I know, it's fine. It's not. It doesn't need to summarize it, but some slides is going to maybe emphasize more. No, it's fine. No, it's very fine. Shake it. It's very fine. Hello, everybody. Welcome to today's webinar. Um, I feel like we should give some people time to still join, right? This webinar
It's
is
okay.
supposed to have started since 12 p.m. GMT, right, which is 3 p.m. my time. But I would want us to, be patient for maybe another 3 minutes to allow more people join. We'll have viewers joining us via YouTube. I would also have viewers who would join us here in the studio, right? And yeah, when we have more people join, then we just kick off. Thank you for your patience while we wait for them. All right, guys. My name is Victor, and today is the second edition of our sexual abuse slash violence series. So welcome once again, wherever you're joining us from. Those in Nigeria I'm sure we have viewers from Nigeria, but wherever you're joining us from, you're welcome to today's webinar. And if you have been following us, you would know that today is going to be the second edition, like I said earlier, right? We had our first edition, which focused on sexual abuse. But today we are specifically focusing on child sexual abuse, right? So before we start today's session, we are going to talk about just do a quick recap about some of the discussions we had in the first edition. So in the first edition, we talked about sexual abuse, as a broad topic, and of course we focused on core concepts like rape. We talked about stalking, talked about sexual violence. We also talked about harassment, sexual harassment, right? And we had three amazing speakers with us on that very day. We had Dr. Michael, we had Dr. Marchuku, and we also had Dr. Ifewumi. And they all, broke down all the details about sexual abuse, right? So rape was defined as the penetration, you know, of an object into the vagina, right? Without the consent of the victim. Okay, so it could be the penetration into the vagina, it could be oral penetration as well, right? But penetration has to take place, and when there is no consent, it is regarded as rape. So we did something. We spoke about rape, and we talked about sex, and we said that the line between sex and rape is what we call consent, right? Sex is when consent has been given, but when it gets to rape, it means that consent has not been given. Okay, that was how we defined rape. We also talked about stalking and how the perpetrator, could start from stalking the victim until he perpetrates that very act, right? And our speakers also spoke about how this can be prevented. They spoke about how people can be very aware about situations that might lead to sexual abuse or rape. Okay, like I said, this is the second series, and we want you all to please join in. If you have questions, please keep those questions. We have the chats box. If you're joining us on YouTube, we have the comment section. Please use those spaces to send your questions. And our speaker today, Dr. Michael, right? He's going to be joining us again today. He did, he spoke extensively the last time, and he was someone that has shown big interest in ending sexual violence around the world. So he's going to be joining us again today, right? And while we wait for him, please, like I said, if you have questions, use the chat box and please ask your questions. But while we are waiting for him, right, I'm going to just talk briefly about child sexual abuse, right, and how it has become a serious menace in our society. Okay, child sexual abuse has become a serious problem in our society, and for some reason, the reporting the amount of reports are not substantial. I don't know why that is. But today we are going to talk about the reasons why people are not reporting, these cases. We're also going to talk about, how it can be prevented. We're going to talk about the signs, we should look out for in a child who, might be undergoing abuse, who might be abused currently, or someone who has, already been abused in the past. Okay. But before the expert, Dr. Michael, comes in, I'm going to talk briefly about, what child sexual abuse is, right? Child sexual abuse, is involving a child in any sexual activity, right? And that activity can be anything that feels sexual to the perpetrator, okay? Um, at least, the victim or the survivor has to be, younger than the perpetrator. So it means that there's a power dynamic in play in this regard. Okay, so a child is referred to someone who is under the age of 18. However, this definition of who a child is varies in different contexts, in different regions. Okay, so but generally a child is someone who is under the age of 18. Okay. I'm also just going to briefly talk about some examples of child sexual abuse. One, we have touching of a child's genitals or private parts for sexual pleasure, right? That is one example. Another one is making a child look at or touch someone else's genitals. Okay. Another one is playing sexual games with the child, and all these things are happening against the child's consent because a child is not able to give his or her consent to any to any of these acts. Another one is masturbating or touching yourself while you are with a child, or making a child touch their own genitals. Okay. Another one is putting your body parts, such it could be your tongue, it could be the finger, it could be also the private part, that's the penis, or any object at all into the mouth, the vagina, or the anus of a child. Okay. Before I continue, I understand that this is a very sensitive topic. Okay. So if at any point you feel uncomfortable, please, it's okay for you to step out of this webinar. You can also talk to someone, talk to someone that you trust. It could be an adult. We always encourage disclosure. Do not keep all of these things to yourself. Try to speak to someone that you trust. And we want you to get all the support that, that would help you recover, and heal from any of this experience that you might have been through. Okay. So let's continue. We have another example. It could be sexual phone calls. It could be sexual text messages. It could also be online communication, maybe through any of these online social media platforms, maybe WhatsApp. It could be Instagram, or whatever social media platform it is, right? That's another example. Another one is inappropriately watching a child undress or use the bathroom, right? that is another example of child sexual abuse when the perpetrator watches a child undress, right? Or use the bathroom when it is done inappropriately, right? Then it's an example of child sexual abuse. One final one is what we call child pornography. So it could be creating, owning, sharing, or viewing sexual images or movies that include anyone under the age of 18, right? So this is another example of child sexual abuse. Okay. Um, yeah. Please, if you have any questions as I move on, like I said, please use the chat box and we'll respond to your questions accordingly. Yeah. So one thing I want us to understand is that children cannot legally or emotionally consent to sex of any kind, right? And it's important that we understand that these behaviors can be harmful and have consequences, right? They are very, very illegal. Okay. So I'm going to just define a few terms. A sex offender is someone who commits child sexual abuse, right? There's something we call a grooming behavior, and now that is an action, to create a close emotional or physical relationship with the child, to more easily abuse them sexually. Okay, it involves maybe getting close to a child when you start to say things to the child to prepare them emotionally or physically, and you start to get close to this person. Okay, that is what we refer to as a grooming behavior. And like I said, consent is given permission to participate, in this context, sexual activity, right? And like I said, children cannot give consent, right? Today we have a lot to talk about child sexual abuse, and we are going to, tell you how you can recover if you've been abused in the past, right? We're going to tell parents and guardians the signs to look out for in their children, in their pupils, to ensure that these kids get all the supports that they require and they can recover, from this particular experience. Okay. Um, all of this, information I'm giving to you all right now, Dr. Michael is going to extensively talk about them, right? But what I'm just doing right now is to prep our minds, until he gets here. So once he gets in here, we will just kick off the session. All right, I think Dr. Michael has joined us. He is here already. Dr. Michael, welcome to today's webinar. We are delighted to have you join us today, right? I am going to very quickly, talk about, who Dr. Michael is, and you can see everyone is eager to join today's conversation, right? So Dr. Michael, his name is Dr. Michael Nwafo, right?
Yes.
Dr. Michael Nwafo is a graduate from Nnamdi Azikiwe University, and he has worked in some very prestigious Lagos hospitals like the First Consultant Medical Center, which is also referred to as the Ebola Hospital, and also St. Nicholas Hospital, the prestigious St. Nicholas Hospital. And he did all this before going into his residency training in obstetrics and gynecology at Alex Ekwueme University Teaching Hospital. So after a while there, he proceeded to the United Kingdom to practice, and he has been there for almost 2 years. So Dr. Michael, welcome again to today's session. Like I said, we are delighted to have you, and the floor is yours. All right, so just take it away.
All right. Thank you very much, Victor, for having me once again. Good afternoon, everyone. You're welcome to another session today, to another webinar. Hopefully we'll get well educated and informed, And the topic we have today is the child sexual abuse. So I was wondering if slides could be shown on the screen, or okay, good, very good. So today's topic, like I said, is child sexual abuse. We have the agenda for today, which will include what child sexual abuse is. I'll be using the abbreviation CSA, forms of sexual abuse, the cause, history and statistics, the causes, the CSA conundrum, and why it is underreported, the effects of CSA, which is child sexual abuse, how to prevent it, and what to do after something like this has occurred. Okay, so we move on to the next slide. Now, we have a problem statement, just briefly talking about child abuse as a whole. Which states that about 300 million children between the ages 2 to 4 years regularly suffer some form of physical and psychological violence. Victims are subjected to lifelong physical and mental impairments, and unfortunately, there is an increasing incidence of this level of abuse, and it is still underreported, I must say, and we need to all sit up, especially us as adults responsible for these children. We need to all sit up and actually tackle this problem. Okay, so now, what is child sexual abuse? It is a form of child abuse. So child abuse is like a constellation of various kinds of abuse, which could be physical, emotional, sexual, and otherwise, basically. But today we're dealing with child sexual abuse. And it could also be called child molestation. And is any interaction in which an adult or adolescent uses a child for sexual stimulation means, basically. So it's the employment or use of a perversive, or inducement or enticement or coercion of any child to engage or assist any other person that's an adult in sexually explicit conduct. So this was a definition given by the Federal Child Abuse Prevention Treatment Act. So we move on to the next slide. Now, forms of child sexual abuse. There are various forms of child sexual abuse, which could be engaging in sexual activities with the child. Whether it is by coercion, which is trying to like make the child do what the child doesn't want to do, probably by forceful means, or coaxing the child to doing it, basically. So it could be by coercion or by coaxing. It could also be indecent exposure of the private parts of the child, the genitals, the breasts, fondling, and things like that by someone that is older, so to speak. Although we must know that sometimes child sexual abuse could happen with other children, which may be of the older age group, for example, the adolescent age group, which are all classified under the children. So in Nigeria, the children are the people under the age of 18. So children has to do with young children and also the adolescents. Some other countries, they've brought it down to 16 years, but in Nigeria, I think we still stick with the 18-year rule, so to speak. So child abuse could also happen with an adult, with an adolescent, that's an older child, molesting the younger child. Now, it could be in form of child grooming, in which there is befriending or establishment of some form of emotional connection with a minor. Someone connects with the minor or his or her family with the objective aim to actually in some form of way abuse the child. Now, other forms could be child trafficking and child labor, in which they exploit children to go through a form of work that would deprive them of their childhood and also expose them to these vices, that would make them have, be involved in some form of sexual abuse from an early age. There's child prostitution, which is self-explanatory, child pornography or cyber sex trafficking, in which some people use nudes or naked pictures of children online, where some perverted people actually gain sexual arousal from watching naked pictures of children. So these are some of the perverse things that some people do, which is totally wrong. There's child marriage, which still happen in some parts of the country and also of the world, basically, in which people that are not even up to the age of being classed as an adult married off to some older person. Okay, so these are some the various forms of child abuse. Now we'll go to the CSA history. It's exploded into awareness. It's been there for a while, but exploded into awareness in the 80s. Excuse me. So in which there is a great percentage increase in reports, even though it's still not enough, but there was an increase in reports. So that made people aware of it, so to speak. Now it happens in 1 in 4 girls and 1 in 6 to 7 boys, usually would likely get sexually abused before the age of 18. Now that's a lot if you put into perspective the amount of people in the world today. When you say like 1 in 4 girls and 1 in 6 to 7 boys would likely get sexually molested before the age of 18. So that's a terrible number that we all need to keep an eye on. Okay. Now there's increased risk in younger children, like I mentioned, that are still in their preteen years, and also children with disabilities, for example, speech and language disability, in which it's difficult for them to actually relate this information to their parents or to their guardians that something wrong is going on with them. It is underreported in Africa, mainly due to the patriarchal nature of our society today, which indirectly fosters child sexual abuse. Now, Africa and Asia, has a very high level of sexual abuse going on, basically. And Victor Sengal et al. Noted that between 2.1 to 68.7 of females in Tanzania and Ethiopia, and like 4.1 to 60% of women in South Africa, usually the prepubertal ones, were exposed to some form of sexual molestation, basically. This was in the Open Journal of Social Sciences in September 2020. Okay, so these are some of the historic statistics that we've had. UNICEF also brought theirs in 2005, mentioning that 3 million girls in sub-Saharan Africa, suffer some level of sexual abuse and genital mutilation, in which the biggest prevalence or biggest level of reports have happened in areas like Morocco, Tanzania, and South Africa. So it's a big problem in the world, but especially in Africa, so to speak. Now, I've put a pictogram of some of the incidents. Hopefully, we're able to see it as the slides go ahead. Now, what are the various causes of CSA, which is child sexual abuse? I'll be using that CSA and child sexual abuse interchangeably because that's the abbreviation. Now, poverty is known to be a risk factor in the sense that it creates that avenue for, especially in our society, the African society, creates that avenue for people or for parents to actually make their children to go into some form of things that are not really meant for children to go through, like hawking. Some people pawn their children off to get trafficked to other countries with the hope, in quotes, of a better life, and they get exposed into some form of molestation and sexual abuse of all forms. Lack of social safety in families, negligence, stressful home environment, low self-esteem, on the child because they are not encouraged well enough by their parents, and their people, the parents and guardians are not keeping an eye on them as much as they should, so they become prey to this predators, and it causes a lot of problems in the world that we have today regarding CSA. Some form of disabilities, like I mentioned, speech and language disabilities, in which the child might not be able to relay information well, especially when they've gotten sexually molested by someone, and misunderstanding boundaries. This is on the area of the perpetrators, especially, in which they gain some perverse level of excitement, molesting children. This is wrong, and this should never happen. Okay, so now the CSA conundrum. Why is it underreported? Now, the problem is there's rarely third-party witness or medical evidence. This is because before you get a child to actually report something, they go through a process of, confusion, like, did this actually happen? What exactly has happened? To probably denial, to probably being bullied, or being or their brains being whitewashed by the perpetrators in such a way that they seal their mouth, or they are sworn to secrecy and they can't report this. And other things involved, like the stigmata of child sexual abuse, in which the society looks down up, in quotes, especially the African society, looks down upon people that have been sexually molested, which is not supposed to be. It is not their fault that this has happened. Instead, we should support them. We should give them some level of care and guidance and counseling on how to proceed from this traumatic event that some of them may have gone through. Now, some other factors like denials of the extent and trying to diffuse or trying to reduce the level of blame that should go to the perpetrators. Okay, so sometimes the children might also feel very helpless in especially when it's someone that is an adult, that's involved in this. And instead of, and if you are faced with either fighting, fleeing, or freezing, so it's the fight or flees fight or freeze issue, due to the fact that the person might be a higher figure, to them, like someone they look up to, and they can't really picture it in their brain that someone that they look up to would actually do something like this to them. Secrecy and threats. You hear words like, this is our secret, no one will believe you, don't tell anyone or else something would happen. I do this because I love you, I want to make you feel safe. You hear, words like these that are not, you are not even meant to hear or meant to say to a child. And these are the ways they actually try to like do these perverse acts. And it's really bothersome, and it's something that we need to actually face head on. Okay, now we would go to the how children experience abuse. Now, usually this happens under the guise of love and attention, especially someone that's kind of close to the children. A lot of times, these are people, in places of trust or places of authority that are really close to the children, that can have access to these children. So a lot of times it is not expected that these people will actually try to molest or sexually abuse these children, but most times it is from those set of people. Okay, and it comes out under the guise of bath time, probably trying to take the child for take the child for a bath or something, bedtime, trying to tuck the child in for bed while watching TV on the couch, playing games, probably video games when they are alone in the house or something, engaging the child in small talk, trying to tell the child that the child is becoming a big girl now, a big boy now, commenting on their body features, like saying that they have now a budding young child or budding young adult, and that they would make any man or any woman happy, which is so wrong. These are not the kind of words you should be saying to a child. Okay, now some form of physical contact, using that as an opportunity to actually sexually molest the child, such as in quote wrestling, tickling, fondling, and the likes, basically. So these are some of the things that things that create the avenue for this to happen. Okay, now perpetrator stereotypes. We want to look at the predators, those that actually perform or that perpetrate these acts. 70 to 90% of alleged abusers are people that are known, to the child, or someone that the child knows and trusts. 9 out of 10 of them are in some way related to the abuser. Okay, and 90% of the alleged offenders are male. However, there are some documented cases of female perpetrators. Okay, now around a third of CSA is carried out by older children, or young people that are in the pubertal or adolescent years, carrying out some form of sexual abuse on the younger children. Okay, and you may notice that an abuse, the abuser tends to give the child a special form of treatment, offering gifts, offering them things like biscuits, sweets, or whatever to entice them, offering them treats, taking them on outings when they see the opportunity to. They may also seek opportunities to try to be alone with the child so they can actually perpetrate such acts or put in the child's head, such acts, basically. So these are some of the things, that we should look out for. Okay, now what are the possible effects of CSA? Now, there's the psychological trauma. It puts fear in the child, brings flashbacks, of which you might not be able to understand why this child is having flashbacks, or possibly post-traumatic stress disorder, PTSD. There are health issues that might be involved. The child could be prone to recurrent genitourinary infections, or recurrent sexually transmitted infections, physical injuries, and in the older children, unwanted pregnancies. There's this problem of self-esteem, bringing out the child's self-esteem because they've been molested by an adult, in ways that are unheard of and that shouldn't actually be heard of, or shouldn't actually be mentioned, let alone done or perpetrated. There's poor academic performance, which you might notice in the child after this has actually happened. Anxiety, depression, to the point of actually going for self-harm or being suicidal, having suicidal thoughts and tendencies. So these are some of the things you might notice, basically, as effects of child sexual abuse. Okay, now how to prevent child sexual abuse. Well, there's this saying that goes this way, saying prevention is better than cure, which holds true today. So we want to look at how to prevent it initially. Now, the onus lies on the parents and the guardians looking after the child. Children. So especially in the UK here, children and the elderly, those above 65 years, are considered vulnerable people in the sense that they can easily be exploited, easily be manipulated, and easily be influenced, so to speak. So they are vulnerable people. So children are vulnerable, and the onus lies on the adults, on the parents, those looking after the child, to actually protect the child at all costs. Okay, teach them from an early age the importance of setting the right boundaries. The appropriate way to relate with their peers, whether of the same sex or of opposite sex, with older children and with adults. Make them feel loved, make them feel attended to without prejudice. Okay, only then can they open up to you and tell you exactly what's wrong with them, from the most, in quotes, insignificant things to the very major things. The child is free and able to confide in you because they know they can trust that you're going to listen to them, you won't judge them, and you will take action in the child's best interest. Okay, if you notice any relationship, any situation that appears unsafe or uncomfortable for the child, take active steps to remove them from that situation as soon as possible. Do not wait until the situation escalates to the point of no return. Take absolute steps to actually retrieve your child from that situation and help this child as soon as possible. Now, try to build your child's self-esteem by praising them, when they do well, and even when they made mistakes, try to encourage them, to do better. Correct their mistakes, try to make them do better. Yes, we know that corporal punishment is still legal in our African society, and I'm not going to touch on that basically. But the thing is, it's not every time that you need to actually flog the child or use the rod on the child. Sometimes communication helps. Okay, sometimes you flog the child, but you don't tell the child, or you don't explain to the child why you've done that, or what you actually expect this child to do. And what happens with some children is that they learn on their own ways to actually avert or avoid this situation. They don't learn from the mistake, they just learn better ways to be cunning enough to evade you from knowing what they've done, and become better people at hiding their mistakes or hiding whatever wrongs they've done. But if you speak to them and try to correct their mistakes and tell them why you are correcting their mistakes, that way it actually sinks in better, to actually make them turn a new leaf. That's if they're going on the wrong path. Okay, so these are important things that need to be done. Okay, be a model parent. You are the child's first example. So the classic monkey see, monkey do happens with children and adults. First words that children learn a lot of times come from adults or come from people around them. So try to do things that is worth emulating. If there are things that you would see in your child and you want to correct, start by correcting them in yourself. Okay, try to be a model parent, try to be a model guardian to this child. Okay, so these are some of the things basically that we need to actually learn to do. Okay, keep tabs on your child's internet access. Very important. PG settings are very important. Parental guardian settings are very important on their phones, on their text, on their messages, emails, on the things they see, things they watch. Okay, always try to keep tabs on them. They are children. They are not matured enough to make total decisions on their own. Okay, so you need to keep tabs on them. You need to guide them appropriately on the right path so they don't deviate from it. Okay, so communicate more with the children, with your child. Have discussions with them according to their level of maturity. There's a level of discussion you can have with an adolescent, and there's a level of discussion or explanation you can give to a child under 5. So have discussions with them based on their level of maturity. Ask open-ended questions. That way they are able to open up to you and tell you exactly what's wrong with them at each point in time. Okay, and listen to them, answer their questions regardless of how weird it might sound. Try to give them an answer to their questions depending on their level of maturity. Okay, in this way they are able to confide in you because they know you'll be able to find a solution or guide them towards help if they find themselves in a problem. Okay, do not leave your child at home or leave your child anywhere without adequate supervision. Okay, always be wary and aware of individuals around your child, family, friends, people at school, always be wary, always keep in mind that you should not leave your child without supervision. Okay, install measures to ensure that there are frequent check-ins, to find out how your child is doing. Okay, especially if you're away for extended periods. For example, you need to go to work and all, basically. Okay, so now, if your child has a disability, this means you need to pay extra attention to the child more, set appropriate boundaries, teach them the role of consent, pay closer attention to them, and never leave them unattended without a trusted individual. Okay, try ways, find out ways to actually communicate with your child more, especially if the child has special needs and they may not be able to relate, with you as well as other children will be able to. So pay close attention to them, find out ways to be able to communicate with them, however subtle it needs to be. Okay, and always check on them. You need to pay closer attention to them to find out exactly what the problem is and how to actually mitigate whatever it is that is a problem to them. Okay, teach them to always speak up, teach them to always talk to you, be self-aware, and to always know, to speak up to when they feel uncomfortable, if with anyone or with anything at all. Teach them to always talk to you, because that's very, very, very absolutely important. Okay, so I've just put some pictures on slide pictures. Hopefully you'll be able to see it as the slides keep moving on. Now, unfortunately, in some cases we might not be able to prevent sexual abuse in children, and once this occurs, we need to actually find out ways to actually take care of this child when this has happened. First things first, do not blame the child. The child is a vulnerable person, and you do not blame the child for what has happened. The perpetrator of this callous act should be the one that should be punished for this. But for the child, do not blame the child. Try to offer help, try to seek help, seek medical help immediately, especially if it has happened on that same day and the child is wise and astute enough to be able to report it to you on the same day it has happened. Take the child to the hospital immediately. Do not bathe the child, do not change clothes, do not douche or brush teeth. Why is the reason is because you need to proper history, proper detailing of events needs to be taken by a health professional. Physical examination needs to be done, in which they take samples, hair fragments, skin and fingernail scrapings, body secretions, semen analysis, and things like that need to be taken for analysis and for further investigation, further forensics and further criminal investigation, so to speak, so that the perpetrators will be brought to justice. Okay, now is also needed for investigations, in which you need to do some STI screening, pregnancy tests for those that are of age, like that post-teens or late teens, so to speak, and they need psychological support, counseling. They need to actually be spoken to in the right way to be able to go through this, to be able to overcome this trauma, because a lot of times you don't see the effects most while they are children. The effect starts while they are kids, but a lot of times it affects people later in life. So you want to curb that as soon as possible. So they need guidance, they need counseling, they need psychological counseling, they need psychological therapy, psychotherapy, and all, basically. So they need all those things. Okay, follow up assessments with the healthcare provider, and even if some time has passed after this event, always seek medical advice. It's very important. Seek medical advice. Go to the authorities and report this, okay? And this needs to be looked into and the perpetrators brought to justice, okay? So these are very important things that needs to be done. So sexual abuse, once again, is a big issue, especially in children, which we're discussing today. And the onus lies on us adults, lies on parents, lies on guardians, to actually pay attention, to actually do their best to look into this issue and protect the child at all costs. They are a responsibility, and we need to make sure that they are well taken care of and well looked after. Okay, so next slide. I just put in a picture about steps to learning to protect children. Okay, learn the facts, minimize opportunity for this to happen, talk about it, recognize the signs, and react responsibly. Possible signs, such as them being unusually quiet, okay, poor academic performance, unusually aggressive, saying things, you hear some words from their mouth that it's not usual for them. These are things you need to pay attention to. These are things you need to look into, and try to talk to them. But first off, try to build that relationship with your child. It's very important, because if you don't build that relationship with your child and they feel that whatever they come to you with, you use the rod first before actually trying to correct them, or actually trying to speak with them or let them confide in you, then they stop confiding in you. They regress into talking to probably their peers, or probably not even talking to anyone at all, and this builds up and causes problems right now and later in life. Okay, now next slide, please. So always try to keep children safe. Okay, so I was just wondering if anyone knows when the Sexual Awareness Month is. Anyways, Sexual Awareness Month is in the next slide. It is April, so it is both for child abuse prevention and also for sexual assault awareness. So it's in April of every month. So we need to pay attention to that and always try to create this awareness wherever we find the opportunity. Next slide, please. Thank you very much. Thank you, everyone. And we'll be taking questions afterwards. Thank you.
Thank you very much, Dr. Michael. That was really extensive, and I believe that we've all learned one or two things. And the whole idea behind this is to ensure that we are creating more awareness, and we are educating both young children and parents about how they can identify all of these signs, and how they can be more supportive and protect their children against sexual abuse. Right, so I am going to there's a question that we've gotten from our YouTube page. So it says, at what age do we start talking to our kids about sexual abuse? That's the first question, Dr. Michael.
Okay, sorry, could you take the question again? I just briefly got locked out. Sorry, could you take the question again?
I will. So the question is, at what age do we need to start talking to our kids about sexual abuse?
Okay, so usually discussions about sexual abuse depends on the child, and also depends on their level of maturity. We find that these days kids get matured at much younger ages than in previous times, and also even amongst children of this age group, or children of these times, there are different levels of maturity, so to speak. So and at the same time, there are different levels of talks you should have with children, basically. From for the under five, so to speak, you need to teach them things at their level, so to speak, like telling them about adults, not touching their private parts, and explaining to them what those places are. You might not go into deep details about it, telling them or explain to them all their body parts, especially the private parts, what those places are, and how someone that is not their parents is not supposed to go there to touch them. And even if there is someone close to them, like a close adult or a guardian that is probably touching them inappropriately in those places, they need to speak out and say that they don't want that. Things like that need to be said early enough, even from an under five age group. You don't need to go into details to start explaining such things to them, but you need to start talking to them about this. This is your chest. This is your private parts. This is what it is meant for, in terms of maybe use it to wee or something like that, so to speak. You might not go into details concerning the sexual nature or sexual function of those places, but you need to give them the basics of what those things are used for, and why no one should actually go there to touch them for any reason at all. You need to tell them not to be in secluded areas with adults that are not known to them. And even if they are known to them, you need to make sure that they are not coming close to you or touching you inappropriately in any way. If you feel uncomfortable with any form of touch, report to me, speak to me, tell me immediately. This is even from under five, so to speak, especially the 4 years and the 5-year-olds that are able to actually relay information and actually speak to you about a few things. A lot of times they start asking questions from that age group, so to speak. So you need to start speaking to them about things like that. Okay. As they get into their pubertal years, when for the males, when they start having wet dreams, for the females, when they start having menstrual periods, when they start developing breasts, things like that. You need to start going into further details concerning sexual education. There are a lot of times in previous years, parents used to do this thing where you're watching TV with your children, and there's a sexual scene, and you turn the TV off or you switch it to the next station. That was their way of preventing children from getting, information from the internet, from TV shows about sexual information, about sexual, or information of sexual nature. But while doing that, you were not exactly telling the child, why they should engage in sexual practices at that age. So you need to speak to them, especially when they become pubertal, when they get into puberty. Speak to them about the sexual functions of their private parts, about the breasts, about the genital areas, about the sexual function of it, about the fact that they can now, especially for the females, they can now ovulate, and due to the fact that they can now ovulate, they can get pregnant, and things that could happen with that, so to speak. You need to speak to them about this. So at each level, there's a level of discussion you could have with children, so to speak. And sometimes, like I said, the level of maturity differs with various kids. Some of them might come to you with questions that you feel are above their age group. As much as possible, simplify it, to the barest level, and give them the information they will be able to absorb at that point in time, so to speak. But especially when they get to that pubertal age, you need to tell them almost, if not all, about sex, about sexual abuse, about the function of their private parts, about the function of their sexual organs, the usefulness of it, and the possible consequences that could happen if they engage in sexual practice at a young age. So I don't know if this answers the question.
I am very sure this has been very, your response was really explanatory, right? So thank you very much, Dr. Michael.
No
we have another question, right? You may
Yeah.
have addressed this, during your presentation, but the question goes, how do I know if my child has been sexually abused, right? How do I identify some of these signs, to understand when my child has been sexually abused? So that's the
Okay.
question.
That's a very good question. I've touched it in the slides, but I'll go over it again, so to speak. So one thing I have to always reiterate, and I don't know if I reiterated it well enough. Children are different. Your child and someone else's child are not the same. Okay? So you need to know what is usual for your child. If your child is a very outspoken child, someone that actually talks, someone that is very vocal, someone that is very vibrant, and you notice that this child starts detaching, starts becoming very quiet, stops relating with you as they usually would, you should know that something is actually up somewhere. If you notice, that your child has a very good academic performance at school, and the academic performances are dwindling or getting poorer, note that something sinister is going on. Okay, so if you notice that, for example, a child, especially those under fives, for example, are having urinary tract infections, it's not usual for a child to have urinary tract infection. If they start having genitourinary tract infection, complaining that when they wee they feel pain, complaining that they feel bruised around the area down below, things like that, start suspecting that something might be going on. It might not be true for all cases, but these are the signs that you need to take note of, that you need to pay attention to, which is why if you're beating your child as a mother or something, always inspect the child from head to toe, find out, if everything is whole with the child, if there are new bruises, new scars, new injuries, always trying to find out how that came about. A lot of times children, especially playful ones, would have bruises in bony prominences like the knees, the shins, because they tend to fall and things like that. But if you start noticing bruises around the wrist, around the neck, on the face, and things like that, try to find out that, something might be going on. For children that are not really outspoken, and you notice that this child is becoming overtly aggressive, saying words that you've not really heard from this child before, and you're wondering where this child got these words from, especially foul languages or things like that, you need to keep an eye on the child and find out that, okay, probably something is going on. Okay, so these are some of the things you need to actually find out. These are some of the things you need to pay attention to. Once you notice that the way your child behaves, has changed over the past period, pay more attention, pay close attention to it, so to speak. If you feel like your child is now gets to the point of hiding things from you, you know, probably hiding their phones, hiding a few things from you, probably their books, their messages, and stuff like that. I'm not saying forcefully get those things out from them, but try to calmly extract information from them. And hopefully they'll be able to confide in you and tell you something is actually wrong or tell you what the problem is. That way you'll be able to tackle it. So I hope with this few examples, we'll be able to like find out what exactly is going on with our children and take appropriate measures. I hope that answers the question.
Thank you, Dr. Michael. Yeah. So I have a follow-up question, right? And just
Mhm.
to for you to educate parents and even young girls, right? So let's assume, right, a parent has not exactly been speaking to his or her kid or pupil, or for some reason they are not always available, right? They travel all the time. Now, how can we empower these kids, say from the age of say 12, to maybe 16 or 18, before they get to that adult, age? What how can we empower them, for them to be able to defend themselves from attack or abuse? Because there will be times when they'll be alone, right? And they would have to face the attacker themselves. What are some things that they can do or say to ward away such attacks from happening?
Well, I think it's a two-part question, if I got that correctly. Now, the first part would be if you've not really had that connection with your child, how you would, be able to extract that information, how they'll be able to confide in you when things go wrong. I don't know if that's the question you asked, Victor.
Yeah, so
Yeah,
yeah,
so
kind of. Yeah,
okay,
that's the
so
first.
that's the first part. That's the first part of the question. So one thing I would like to say is as long as they are children, no matter how far gone you think the issue you know is, I don't think it's too late to try to start building bonds with your children. Some of us give up and be like, it's too late. I've never really built that bond with my child, so they really don't tell me anything these days. So I mean, why bother? It's never too late to actually try to, build that bond with your children. It might be difficult, it might, but try to speak to your child. Okay. Try to explain. It's very okay to admit to your child that you were wrong about something. That says a lot about you, and that actually helps them confide in you quite a lot more. You can't be right always, which is one thing with our African society. Our parents and guardians a lot of times feel they are right all the time, and we don't usually apologize to our children when we are wrong because we are right all the time, 100% of the time, so to speak. That's not always the case. That which is a myth that we actually need to break. You are not always right. Okay. And sometimes you might need to actually say sorry to your child, no matter how difficult it is. That actually helps, somewhat to make them develop a soft spot for you if they don't have that soft spot. A lot of children have that soft spot for their children, for their parents, anyways. But that helps develop that part for you that okay, my parents can actually tell me sorry when they've done something wrong and actually try to apologize and actually give me reasons for some actions they've taken in case I don't understand it. If you're able to imbibe that, I feel to some extent it starts coming. They start telling you, they might be telling you about trivial things initially, but after some time they might start telling you about deeper things, about probably, for example, the adolescent people or adolescent children, the crush they have, the guy they like in school or the girl they like in school, which is something a lot of parents, especially the older parents, don't want to hear about. These are some of the things that you need to actually pay attention to and not cringe or deflect or choose the violent way to reply to that. I'm not saying it's always the best thing to allow your children have relationships when they are not of age, but you could guide them. in such a way that they understand that, okay, you might have a crush on somebody, or you might like somebody, but it doesn't mean you need to act on it or start developing relationships with a relationship of sexual nature with those people until you are actually of age or mature enough to be able to do that. So these are some of the things we need to actually imbibe, to see if that's going to help us develop some form of relationship with our children, such that if things occur, or if some of these situations happen, they'll be able to like confide in us. Now, empowering children, especially the late preteens and also the teenagers, on how to protect themselves against the assailants. First off, I think it's still a two-part pathway, so to speak. First off, you need to actually speak to them about, give them that sexual education. A lot of times, children get sexual education from their schools rather than fresh from home. I don't think that's proper. You need to get that sexual education from home first. Your parents need to actually sit down and discuss with you and tell you those things that you need to know, especially about sexual education, especially when they are getting, or they've gotten into pubertal years, so to speak. So teach them about sexual education. Teach them about the functions of their sexual organs and genital areas. Okay. Teach them about the need to actually wait, and not engage in sexual practices and the harmful effect of sexual practices at this point in time, rather than waiting till when they are actually matured enough. And when they are faced with assailants, a lot of times we find that a lot of times they are helpless, because the assailants a lot of times are adults that are stronger and that will be able to overpower them. Okay. So if there are ways to actually teach them defensive sports, for example, some people teach their children martial arts, teach them from little. I have colleagues that have children that go for judo practices, that go for karate practices and things like that. It's not a bad thing to actually do that. You could teach, if you have the means to enroll them in those classes to be able to like defend themselves. Some people actually have pepper sprays in their bags. That could also help. Things to actually defend themselves, to be able to escape the assailants. But in points where they might not be able to, despite all this, it's unfortunate that it might happen, which is why it has happened a lot in various cases. Which is why I've said, in cases where they've tried all this and it doesn't happen, they should be confident enough to confide in you, no matter how bad it is, to tell you what has happened as the adults, which is where you need to actually step in and take actions. Because sometimes a lot of parents work long hours, walk away from home, and might not be available 24/7 or most of the time to actually look after their children. So this means you need to communicate, try to, at the little time you have, communicate with your child more. And sometimes you have people you can actually trust. Not in all cases, but you have some trusted guardians that you can put your children under, okay, that might be able to look after your children when you're away. Okay. Some other times, some people have taken steps or measures towards putting cyber security in the houses, such that there are cameras everywhere watching, the house, in case something sinister is going on or is happening in the house, so to speak. So these are some of the ways you can actually, curb some of these activities and stop them from happening recurrently. Okay. Some other things might also be to also teach them to mention when they are uncomfortable with someone. It doesn't have to be when this has actually happened. If they are uncomfortable with someone from the family, and a lot of times children, which is another issue. Some children mention that something has happened, or mention that they are uncomfortable with this person being around them. And because you've known this person longer than you've known the children, you tend to believe the person, or you tend to believe that no, this person can't do such a thing. Yeah, it's always good to build some level of trust with close relations and relatives and all. It's fine. But at the same time, always listen to your child. If your child says he or she's not comfortable having this person around, remove your child from that situation. The first thing to do is remove your child from that situation, then investigate further, rather than deflecting whatever your child has said just because you feel that adults or that trusted person cannot perpetrate such acts. It might surprise you that they're actually doing it. So remove your child from such a situation before it actually escalates, and investigate the issue through the various means I've mentioned. So I don't know if that answers the question or if I need to throw more light.
No, it does actually, Dr. Michael. Just in
Okay.
addition to everything that you said, yeah, I think some other things that we can do, that we can tell young people to do, that's the adolescents to do, is we can teach them mental skills and verbal skills, right? So we can teach them, how to lie. So, for example, when an adult tells you, "Go and get me this and bring it into my room," we can teach them things like, "Oh, no, no, my mother is coming, right? I have to, attend." Just teach them how to lie, so that they can get away from that situation, especially when they know that this particular adult has been, acting suspiciously in court. Teach them verbal skills, how to say no, right? How to be very assertive when they say no. I understand that there are cases where it might be difficult for them to actually say no because of their safety. These assailants might obviously be older than them, right? So I would always encourage the fact that physical, using physical defense should be like the last resort, because when you apply a physical skill or a physical defense skill and you are not able to get away from that particular situation, you might just make it worse, right? The assailant might become very angry, maybe because you tried to punch him or something and you were unable to do it, or maybe because you tried to use the spray on him and maybe he didn't get to his eyes, right? So that might even aggravate the situation. So there are other skills that I would maybe encourage young people to learn, which are mental skills, lying just to get away from the situation, distracting, whenever that conversation comes up, distract that conversation, start talking about something else, right? Some people can even act crazy. I've seen a case where a girl acted crazy just to make the assailant scared or get the assailant confused, right? So those are some very subtle tools or skills that young people can actually do to just get away from that situation. But at the end of the day, their safety is very, very paramount. Thank you, Dr. Michael. There is another question, right? As we wrap up this webinar, there's a question. So someone said, "These kids seem to know even more, right? How do I continue teaching when I have a child that reads so much? How do I continue, talking to this child?"
Well, that's a very good question. But the thing is, having a kid is a major responsibility. I don't think people actually know how much of a responsibility it is to have a child or to have another human that is dependent and that you're responsible for. It's a very, very big responsibility, and it takes a lot of sacrifice to actually have and raise children the right way. So the fact is that you need to actually read more. It's very important. So if your child reads so much, I believe you need to read more. If you don't have that information at that point in time, it's always good for you to go back and check the information and find out better ways to actually relay the information to your child that would be understandable to the child at that point in time. Okay, so like I said, it's important that you have the information. Always try to have the information as much as you can. Always try to answer the questions your child has as much as you can, because they're going to come with a lot of questions, and if they don't get the answer from you, they'll get it outside. So as much as possible, yes, we understand that with this internet days, a lot of children go into the internet, learn information, read so much, and gain so much information, much more so that you might not be able to, catch up with them. Or as much as possible, as much as you can, read more pertaining to things that concern your child so that you'll be able to answer their questions too, so to speak. So answer their questions as much as you can, so to speak. Okay. And hopefully with that we'll be able to like raise kids that are better. I don't know if that answers your question, but it's a big responsibility to actually raise children, and I quite understand. But we need to actually try to equip ourselves with more information, which is why there are avenues like this to actually learn, things to do and things to actually not do for children, especially depending on their age group. Now, I think someone asked someone, I'm just going to answer this question immediately because he said, is it wise to encourage a child to have a spray? I think one thing I mentioned while explaining was depending on the level of maturity of the child, depending on the age group of the child. You're not going to ask a 5-year-old to have a pepper spray, because first of all, it's not even safe for them to have a pepper spray. We have to understand that there are two age groups that are classified as children. There is the pre-pubertal ones, on the 12s and the likes, and there are the pubertal and post-pubertal ones that are the teenagers and the adolescents. Those are older children, okay, of which a lot of them have grown up so much that if you don't ask their age, some of them might look older than their age because they've matured both reproductively and otherwise, so to speak. Now, if they are matured enough to actually get up to that age, a lot of times their reasoning are also close to what you would have in a young adult, like 18-ish and above. If they are able to use that, then fine. But that should be like the other speaker said, like Victor said, a last resort, so to speak. Okay. If they can be trained to actually have that, fine. But it's not something that you give to every child that you say, okay, have a pepper spray. Okay. First of all, teach them to be able to be verbal enough to speak out, which is something I've touched in the slide, so to speak. I was just using that as alternatives, apart from being verbal enough to actually be aware to say no, or to be aware to know the boundaries that need to be set between them and children of their peers, of their age group, children of older age group, and also the adults, so to speak. So those skills should be learned first. Then in addition, they could learn defensive skills too, so to speak, which is where the pepper spray comes in. And of course, you cannot give pepper spray to children that are still, still in their under 12s or under 5s, and so to speak. They won't really know what to do with that because it will actually cause more harm than good to them, so to speak. Okay. I think there was another question. I don't know if you saw it, Victor, because
Yeah,
I'm
so
not sure
it
I'm
is.
saying it.
Do you think getting a phone for a child would help? So I want to understand. I don't know who has. I think Gabby's phone would ask this question. So getting a phone for a child, will it help? Is it reduce or prevent
It's a very vague
child sexual
question,
abuse?
Gabby. I don't know if you could throw
Yeah,
more light on the question.
yes. So if you can be more specific, let's understand. In what area do you think, or are you asking, for it to help? Is it to help, you communicate more with your child if you're always away, or is it, for a child to learn, how to actually prevent themselves? So please, if you can be more specific, Dr. Michael is always willing to respond to your question.
Okay.
While Gabby's forward is trying to make that question more specific, Dr. Michael, you have always been very, available, and Hope for Hopeless Initiative really, really appreciate you. And yes, so another question just came in, right?
Yeah.
I think we'll begin to wrap up. So I'll take this question. Okay, this is not a question. I think this is a comment. It says sexual abuse includes things like this: making sexual jokes, comments, or using gestures, spreading sexual rumors, either in person, by text, or via social media, posting sexual comments, pictures, or video taking, right? Or sending sexual pictures or videos asking someone for naked pictures of themselves, asking for sex or offering to have sex, touching or grabbing someone in a sexual way, right? So this is a comment I think someone posted in our private chat, and yes, I'm sure these are all examples of sexual abuse. Dr. Michael has really, expatiated about those forms of sexual abuse, and it also extends to all of these things that have been mentioned, right? Whatever makes you uncomfortable, whenever consent has not been given to any act, especially when, like there's a power dynamic in play, when there's an adult and a child, right? All of this, can be referred to as child sexual abuse. And we should try to, talk to our kids, like Dr. Michael has been saying, for them to be able to identify, when all of these things, are coming up, during their conversations with whoever it is, and teach them how to, stay away, or face it, assertively, and overcome it so that it doesn't happen to them. Yeah. So that was a comment. Gabby, we still need you to be more specific. We are really interested in responding to your question. So if you can be more specific, I think that will be the last question for today, right? So while Gabby is still trying to respond to that, please, you can still watch this. It's on our YouTube page, Hope for Hopeless Initiative. It's I think it's live right now, so it's gonna be recorded there. So go back there, watch it, and if you still have questions, please leave your question in the comment section. And Dr. Michael, whenever he's opportunity, will always go there and respond to all your questions. So Gabby, you can also type your question in a comment section on YouTube, and he will always respond to that question. If you can ask it right now, if you're not available to ask the question. So I think she has asked that question. Let me take it. Let me see. Just Googled and I noticed my neighborhood. Okay, so someone said, okay, she just typed, she said, just Googled and I noticed my neighborhood, they are full of, is it pedophiles? I'm saying pedophiles here. I'm sure she meant to say pedophiles, even though it's
Yeah.
a white neighborhood, right? And I have my child, always walking home from the bus stop. So is getting her a phone with a SIM, you know, good? Because personally, I do not want to, right? So, but listening to the teaching today, I don't know what to do. So because of that fact, because she always walks home alone from the bus stop and she has not observed that there are a lot of pedophiles, that are very pervasive in our neighborhood. Do you think getting her child a phone would help? Maybe to reach out to her when there's danger, just to alert her in case there is any, danger. Yeah, Dr. Michael.
Okay. Well, that's a good question. But first thing I would say is, which I've said severally, but I would like to reiterate it once again. Every child is different, and there are different ways. The way you train this child A might be different from the way you train child B, because they are totally different from each other. Okay. Now that being said, um, it depends on how you know your child, how you understand your child. If I were to be in your shoes, and I had that kind of neighborhood, uh, having a phone, that might have maybe limited internet access, or that will be probably restricted towards being able to make calls, I don't feel it's something out of place, especially if that would avail her or avail him the opportunity to actually ring you immediately and say, "Hi, mom, something is up or something is wrong," and all basically. So if that avails the child the opportunity to be able to do that, I think is something that is very important. Now, are there cons cons to this? Yes, there are. There are pros and cons of which you should consider, which is why I said each child is peculiar. So you need to consider the pros and cons with your child and find out if the pros are more than the cons. Okay? Possible cons. If you probably feel the child will use that to start having some kind of messaging, or using it as a messaging device with people that you don't want them to actually be, or people that you're not comfortable with them, messaging or texting or something like that. That's possible. Those are possible cons that could come with having the phone. But the fact is, you have to weigh that with the pros. It avails you the opportunity to be able to speak to your child almost instantly, especially if something goes wrong. Okay, your child can easily contact you if they are in danger of one issue, in danger, or in a particular situation that is not good enough or that is not proper. And if the child's level of maturity at 10 is enough that they can handle a limited internet access phone, it might not have all the internet access that the usual phone have, but will be able to at least make and receive calls, and you feel your child will be able to handle that, and you've considered the pros and cons, and the pros are more than the cons, especially given the kind of neighborhood you're in, then you getting a phone for the child with maybe a limited access to the internet might just be the right answer. But like I said, every child is different. You need to consider this and relay the information with your child and see if the pros outweigh the cons, the benefit outweighs the risks for your child, and then make the decision based on that. I don't know if that answers your question.
Thank you, Dr. Michael. I hope that response has been able to attend to your question, Gabby's phone wall. And if not, please, you can still reach out to us. You have our email address. It's info@h4hinitiative.org, or you can always still drop your question, like I said, on our YouTube page, and Dr. Michael would always, respond to it. Yeah, yeah. So I think she's quite satisfied. She just said yes, thank you. All right.
Okay.
So thank you, Dr. Michael. Today has been very insightful. Yes, like I said earlier, we really appreciate you, and thank you for being with us today. Right? Yeah. So guys, please, you can always watch this on our YouTube page. Go visit us, like this video, subscribe to our YouTube page, and we would have more webinars like this coming up soon, and just try to be a part of it. Okay. We have come to the end of today's webinar. Thank you so much, everyone. Those of you that joined via YouTube, those of you here live in the studio. Angor, thank you for your comments. We really appreciate it. And for everyone else, like I said, thank you all for coming today. All right, so I think we're gonna wrap up here, and I'll just say bye. Or we can say something. We can all say deuces, right? So in front of mine, we always say deuces or ciao. So guys, let's just say deuces. I'll call it a day. Thank you very much. Yeah, deuces, guys. Yeah, bye.